the ACCHS sector and what's happening both at a local level and a national level. So it's my privilege to introduce Lorraine Taui from ACCHS, who needs no introduction really, but has been pivotal in a lot of the training initiatives that are really facilitating our workforce development, and very passionate and lively character for those of you who know her. And she's going to tell us about the recent forum that was held by ACCHS around ear health. And then we'll be going on to hear from Nachos and what's happening from a national perspective. But welcome, Lorraine.
Good morning, everybody. Before I go any further and make any further comments to Peter, I'd like to acknowledge the traditional owners of the land we stand on today, the Whadjuk people and of the Noongar Nation. My apologies. We pay respects to our elders, past and emerging, alongside those of culture that we join today and moving forward. Thank you, Peter, for the introduction. Thank you all, and I also acknowledge the welcome to country this morning that was held by Frida, which was beautiful. So great to see everybody here today. I was told that I had 10 minutes when I only wanted to do 1 minute. Just to do a little bit of a background, the ACCHS Ear Health team host and facilitate the ACCHS Ear Health Forum on behalf of all our member services in the sector. The forum was established in 2017 as requested by all the member services in the sector. It's an opportunity to come together in unity. ACCHS representatives working in the ear health field were delegated by their service leads to provide highlights, challenges, and solutions to move forward with relevant to ear health. So we meet on a quarterly basis, and one of the biggest asks was to hold a face-to-face event once a year. And this is the first time we've actually worked in partnership with Rural Health West to hold this event, so which was a great success. So to recap on what we discussed yesterday, there was a lot of great discussions that was raised, one of which you heard earlier from our lovely ladies from Mortgage Court, discussing about the good news stories, success stories, recognitions of most of our member services who spoke to us yesterday. So just to give you a bit of a insight to some of the standouts that was discussed yesterday, and I'm just winging it because I've got 10 minutes. And there was a lot of humour, actually, that came from it. So just as another standout, we had SWAMs who spoke to us, and they spoke of one of the projects that they have, which is called Welcome to the World, nappy covers that were made from curtains. Absolutely wonderful little things, except they didn't bring the babies. A nomination was also put forward for the SWAMs team for the great work that they're doing in their community, and the nomination was put forward by Professor Jaffrey. They received the President's Award at the 74th Annual ACCHS Scientific Meeting. So a big hand for them. Scroll down. A lot of the services Also, not only did they put forward highlights, success stories, they also put forward a wish list, a money tree, one that I don't have. So hopefully, Peter will give me a loan to move forward with. Just keep coming down. The wish list also included some of the challenges and the discussions that were raised, and Peter actually outlined that in his little spiel about the WA Air Health Strategy and some of those concerns or improvements to be made. What came of it was a money tree, more funding. Also, we need to rethink about ENT, advocacy, coordination needed. Wait times are excessive. More funding needed from state as a sustainable model. We also had representatives coming in to talk about the immunisations, one of which from the ACCHS team as well. And she spoke of the connection between ears and immunisations, and also came up with a really good slogan, immunisation. Keep coming down. We also had one of our other member services from the Pilbara region as well, and talking about fast-tracking surgeries and going out into communities and, looking at that fast-track preferred approach as well. Another highlight we had, and you're going to be hearing from these ladies today, one of which is Nacho, who spoke about the co-design and the strategic priorities from the national strategy framework that's about to be, which were 5 priorities they were talking about, and you're going to hear about that today. We went in a little bit further to talk about, and we just briefed on the national KPIs in KPI pilot that's out at the moment, relevant to air health. And we had a brief discussion about that. Moving forward, I think we need to have more discussion on that as well, so hopefully we'll hear more on that. Last but not least, we also had the ACCHS team who came in and talked about the environmental health, which Peter had actually referred to earlier in his discussion. And they talked about the creation of the model and the six domains that came from that. Currently still discussing, that's still in discussion at the moment, and the funding to be further discussed around that. So presentation to Department of Health will be on the 14th of August. And of course, last but not least, as Peter mentioned, one of my biggest passions was around training and getting that, professional development in this field, and working alongside TAFE and SW, and you're going to hear from them today. So I'm going to be hiding behind them. And the work that our journey in WA, and none of this could happen without all of you, and the support of our management as well, as well as Nacho, who we're currently getting support from as well. Other than that, the partnership with Rural Health West, all the way through, and to make this event successful, has been the greatest as well. So I have to give recognition to our team, Dream Team, and Fiona as well. So big ups to them as well. So recognition to them. But that's what's come from yesterday, and we've had a great discussion, and you're going to hear a little bit more from those members that also presented yesterday. So